Fraud, waste, and abuse, and HIPAA training. Fraud, waste, and abuse. Centers for Medicaid and Medicare Services, also known as CMS, which is an agency within the U.S. Department of Health and Human Services, is responsible for several healthcare programs and handed down new rules regarding fraud, waste, and abuse that must be followed by MTM, first tier, downstream, and related entities. These include providers, drivers, and office staff. This training is required by CMS and MTM clients. We are all responsible for preventing fraud, waste, and abuse, and reporting suspected cases without fear of reprisal. Training will give you basic information necessary to understand what fraud, waste, and abuse is, and what your obligations are if you suspect it is happening. By knowing the basics of fraud, waste, and abuse, we are in compliance with CMS and MTM client requirements and help reduce potential for future fraud, waste, and abuse. By looking out for fraud, waste, and abuse, we protect federal funding given to Medicaid and Medicare programs for non-emergency medical transportation. Some of the topics that we will be covering are fraud, waste, and abuse definitions, why MTM conducts fraud, waste, and abuse training, applicable federal laws, fraud, waste, and abuse obligations, examples of beneficiary fraud, waste, and abuse, examples of first tier, downstream, and related entity fraud, waste, and abuse, who's responsible for identifying fraud, waste, and abuse, who's responsible for monitoring and auditing fraud, waste, and abuse at MTM, preventing fraud, waste, and abuse, reporting fraud, waste, and abuse, and protection for whistleblowers. What is fraud? Fraud is an intentional deception or misrepresentation made by a person with knowledge that deception could result in unauthorized benefit to himself or another person. This includes any act that constitutes fraud under applicable federal and state law. What is waste? Waste is the overutilization of services or other practices that result in unnecessary costs. Generally not caused by criminally negligent actions, but rather misuse of resources. What is abuse? Provider practices that are inconsistent with sound fiscal business or medical practices and result in unnecessary costs to Medicaid, Medicare program, reimbursement for unnecessary services or services that fail to meet professionally recognized standard for healthcare, and includes cover beneficiary practices that result in unnecessary costs. MTM does business with Medicaid and Medicare clients. Clients are required by CMS to conduct fraud, waste, and abuse training with first tier, downstream, and related entities, also known as subcontractors. MTM must do the same with our first tier, downstream, and related entities, which are transportation providers, drivers, and office staff. Because MTM clients are regulated by CMS, so is MTM and our subcontractors. Documentation of annual fraud, waste, and abuse training must be maintained and available to CMS and clients when requested. Training requirements. Applicable laws and regulations, federal and state specific, obligations to have policies and procedures in place to address fraud, waste, and abuse, types of beneficiary fraud, waste, and abuse, and possible resolutions, types of subcontractor fraud, waste, and abuse, and possible resolutions, process for reporting suspected fraud, waste, and abuse, protections for employees who report fraud, waste, and abuse. Laws and regulations. Suspected violations of False Claims Act, Stark Law, Anti-Kickback Statute, suspected marketing violations including inducements, acts defined in the 18th USC Chapter 47, Health Insurance Portability and Accountability Act, state-specific laws and regulations that address Medicaid and Medicare fraud, waste, and abuse. Your obligations. Your obligations as a company is to have policies and procedures in place to comply with all policies and procedures developed and amended by MTM relative to fraud, waste, and abuse. Acknowledged payments made to you consist of federal and state funding. You can and will be held civilly, criminally liable for non-performance, misrepresentation, or fraud, waste, and abuse of services rendered to MTM and its clients. Immediately refer all suspected or confirmed fraud, waste, and abuse to MTM. Examples of beneficiary fraud, waste, and abuse: changing, forging, or altering prescriptions, medical records, and referral forms. Lending insurance card to another person. Identity theft. Using non-emergency medical transportation for non-medical services. Misrepresenting eligibility status. Resale of medications to others. Medication stockpiling. Doctor shopping. This refers to the practice of a patient requesting care from multiple physicians, often simultaneously, without making efforts to coordinate care or informing the physicians of multiple caregivers. Resolution options for beneficiary fraud, waste, and abuse. Add a note to the beneficiary file advising MTM for future trips. Add beneficiary's name to a list of frequent abusers. Trip requests will be monitored and managed to prevent future fraud, waste, and abuse. Report issued to designated state or county Medicaid office or MTM client. Examples of provider fraud, waste, and abuse: falsifying credentials, billing for services not rendered, inappropriate billing, double billing, upcoding, and unbundling. Collusion among providers, agreeing on minimum fees they will charge and accept. Falsifying information submitted through prior authorization or other mechanism to justify coverage. Resolution options for provider fraud, waste, and abuse: recover trip cost, provide education, make recommendation for an audit of trip records, establish a corrective action plan, also known as a CAP, disciplinary action, and dismissal from MTM's network of providers. Who is responsible for identifying fraud, waste, and abuse? That would include MTM employees, the board of directors, transportation providers, drivers, office staff, and DOM. Who monitors fraud, waste, and abuse at MTM? Cases reported to Quality Management Department. Compliance Auditor investigates each reported accident, and the notes result of investigation in the beneficiary's file. Fraud, waste, and abuse is reported against first-tier downstream or related entities handled in the same manner. MTM reports incidents of fraud, waste, and abuse to clients on a monthly basis. Preventing fraud, waste, and abuse. Preventing fraud, waste, and abuse before it happens is critical. First tier, downstream, and related entities as it relates to MTM writers should report incidents of fraud, waste, and abuse they suspect to MTM's Quality Management Department immediately. MTM staff are diligent and watch carefully for signs of fraud, waste, and abuse. Deny a trip if it seems suspect. Push trip requests up internal chain of command to team lead. Contact client and get their guidance. Employees of MTM also contact quality management of suspected fraud, waste, and abuse. Reporting fraud, waste, and abuse. Contact MTM's Quality Department at 1-866-436-0457 Try to include all pertinent information: the subject of fraud, waste, and abuse, the subject ID information, fraud, waste, and abuse description, and any other important information. MTM then reports to DOM. Fraud, waste, and abuse reporting protections. Whistleblowers offered protection against retaliation under the False Claims Act. Employees discharged, demoted, harassed, or otherwise discriminated for reporting fraud, waste, and abuse, or as a consequence of whistleblowing, are entitled to relief necessary to make the employee whole. Fraud, waste, and abuse conclusion. The training has given you knowledge about what fraud, waste, and abuse is, and why it is important to identify cases of suspected fraud, waste, and abuse. Tools necessary to feel confident in reporting suspected fraud, waste, and abuse without fear of reprisal. Understanding of why MTM requires training. Knowledge that everyone is responsible for reporting fraud, waste, and abuse. Knowledge that preventing fraud, waste, and abuse is critical. Stop it before it happens. HIPAA, Health Insurance Portability and Accountability Act. Introduction. This training will provide information necessary to ensure beneficiary health information is regarded with privacy and security. Provide information necessary to meet standards for privacy and security set forth by governing agencies. Focus on daily functions of transportation providers to ensure beneficiary privacy and security. The background of HIPAA. It was enacted by Congress in 1996. The Department of Health and Human Services, also known as the DHHS, implemented final privacy rule on April 14, 2003. Compliance date for security standards was April 20, 2005. HITECH Act of 2009 widened the scope of privacy and security protections available under HIPAA. The HIPAA Privacy Rule. It ensures nationwide uniform procedural protection for all health information. It imposes restrictions on use and disclosure of protected health information, also known as PHI. It gives people greater access to medical records. It provides people with more control over health information. HIPAA Security Rule. The Privacy Rule deals with PHI in general. Security Rule deals with electronic PHI, also known as ePHI. The Security Rule for ePHI greatly expanded in 2009 under American Recovery and Reinvestment Act. ARA 2009. HITECH Act of American Recovery and Reinvestment Act of 2009, also known as ARA, imposes new obligations on a covered entity, also known as CE, and business associate, BA. This includes breach notification, the business associate directly responsible for compliance with security rule, and the business associate liable for violations of security rule and breaches. HIPAA expectations. The use or disclose of PHI, or also known as personal health information, only for work-related purposes. Limit use and disclosure to minimum necessary to accomplish intended purpose of use, disclosure, or request. Exercise reasonable caution to protect PHI under your control. Understand and follow MTM privacy policies. Report privacy problems to supervisor and MTM immediately. Protected health information. PHI is individually identifiable health information that is transmitted by electronic media, maintained in electronic media, transmitted or maintained in any other form or medium. When MTM, beneficiary, agency, or health provider gives personal information to MTM, that information becomes PHI. Examples of PHI: any information that might connect health information to an individual, like the name or address, social security number, or other ID number. Medicaid, Medicare number, physician notes, and billing information. Additional examples of PHI: all geographic subdivisions, street address, city, county, precinct, zip code, and their equivalent geocodes if according to the current publicly available data information from the Bureau of the Census, the geographic unit formed by combining all zip codes with the same 3 initial digits contains 20,000 or fewer people. If the geographic unit formed by combining all zip codes with the same 3 initial digits contains more than 20,000 people, DUM may provide the first 3 digits of the zip code. Additional examples continued. All elements of dates except year for dates directly related to an individual, including birth date, admission date, discharge date, or date of death. All ages over 89 and all elements of dates including year, indicative of such age, except that such ages and elements may be aggregated into a single category of age 90 or older. Telephone numbers, fax numbers, email addresses, medical record numbers, and account numbers. Certificate or license numbers, vehicle identifiers, and serial numbers including license plate numbers, device identifier numbers, and serial numbers. Web Universal Resource Locators, also known as URLs. Internet Protocol, address numbers. Biometric identifiers including finger and voice prints. Full fax photographic images and any comparable images. Any other identifying number, characteristic, or code that reasonably could be used to identify an individual, except as permitted for re-identification. Use or disclose of PHI. The privacy rule covers use and disclose of PHI. It is designed to minimize careless or unethical disclosure. PHI can't be used or disclosed unless it is permitted or required by the privacy rule. Use versus disclosure. PHI is used when it is shared, examined, applied, or analyzed. PHI is disclosed when it is released or transferred, accessed in a way by anyone outside an outside entity holding information. Use or disclosure of PHI. PHI may be shared when it's for TPO, or also known as treatment, which is the management of healthcare and related services that includes coordination among healthcare providers, payment, which is various activities of healthcare providers to obtain payment or reimbursement for services, and healthcare operations, which is certain administrative, financial, legal, and quality improvement activities of covered entity necessary to run its business and to support core functions of treatment and payment. Transportation providers permitted to use or disclose PHI for scheduling trip information, confirming special needs or adaptive equipment, and incidental use such as talking to a facility or medical provider. Minimum necessary. Use or disclosure of PHI should be limited to minimum amount of health-related information necessary to accomplish intended purpose of use or disclosure. MTM has developed policies and procedures to make sure the least amount of PHI is shared. If you have no need to review PHI, then please stop. Maintaining privacy. Keep information in a folder during business hours and locked drawer after hours. Shred documents containing PHI after use. Keep a minimal amount of information in a hard copy format. Do not leave documents unattended at printer or fax machines. When using the telephone, leave minimal information necessary on voicemail or answering machines regarding confirmation of trips or as beneficiary to return call to confirm. When using faxes, always include a cover sheet that states it is a confidential document that gives a contact if a fax is received in error, and that spells out HIPAA language. Verify fax number before sending. When using email, emails containing PHI must be sent securely. Follow all directions for secured email, and do not enter any PHI in the subject line. When at your workstation or in your vehicle, always lock access to computer with password and use privacy notice. Remove documents containing PHI from copiers and printers immediately. Keep PHI in a folder or upside down during working hours. Remove PHI from desk or vehicle and place in locked drawer at the end of workday. Do not discuss PHI in public areas. Privacy practices designated to protect PHI. Verify identity and authority of requests before releasing PHI. Transmit PHI by telephone only when it cannot be overheard. When leaving messages, limit information left to the beneficiary's name, a request to return call, and your name, company, along with your telephone number. Misuse of PHI. Misuse of PHI can result in civil and criminal sanctions, civil penalties up to $25,000 a year for inadvertent violations, $250,000 for willful neglect, and $1.5 million for repeated or uncorrected violations. Criminal penalties: up to $250,000 fine and prison sentence up to 10 years for deliberate violations. Sanctions by DHHS. Other penalties related to not meeting contractual obligations. Examples of misuse of PHI. A South Dakota medical student took home copies of 125 patients' psychiatric records to work on a research project. He disposed of material in dumpster of a fast food restaurant where they were found by a newspaper reporter. Reporting misuse of PHI. Report incidents of accidental or intentional disclosure to your supervisor and MTM. No adverse action will be taken against anyone who reports in good faith violations or threatened violations of privacy rule, security rule, or related policies. MTM must report to DHHS all uses or disclosures not permitted by business associate provisions of contract or HIPAA. Breach of ePHI. HITECH Act imposes data breach notification requirements for unauthorized uses and disclosures of unsecured or unencrypted PHI. The breach is unauthorized acquisition, access, use, or disclosure of PHI which compromises the security or privacy of information. Theft of 57 drivers at an insurance company's training facility, including images from a computer screens containing data that was encoded but not encrypted. This is an example of breach of electronic PHI. Breach notification. Notice to individual of breach of his or her PHI is required under the ARA HITECH Act. Breaches involving PHI of more than 500 persons in one circumstance must be immediately reported to DHHS by covered entity. It will be posted on the DHHS site. Business associates must report security breaches to covered entity. Enforcement of privacy and security. Office of Civil Rights has informed privacy rules since 2003. CMS has informed security rules since 2005. As of July 27, 2009, DHHS has delegated enforcement of both rules to Office of Civil Rights. HIPAA resources. CMS and the website listed on the page, Office of Civil Rights, U.S. DHHS, the Mississippi Division of Medicaid, HIPAA glossary. A business associate is a person or entity that performs certain functions or activities that involve use or disclosure of PHI on behalf of or provides services to a covered entity. Protected health information, individually identifiable health information,